Hi, my name is Juan Ramirez. I'm going to be doing a video how to change dressing for a trach. I'm going to perform hand hygiene. Hi there, my name is Juan. I'm going to be your nurse today. I'm going to go ahead and change the dressing of your trach, okay? I'm going to remove the soil sterile and the trach and clean the area, okay? Thank you. I'm going to go ahead and sit the patient up at a Fowler position. At this time, if it needs suction, I will go ahead and suction the patient. Before doing that, I will oxygenate the patient so he has enough oxygen. When I suction, the airway gets blocked, so we don't want the patient to drop his oxygen level or become hypoxia. So that's done already. I'm going to go ahead and set up my equipment. So I have my kit right here. I'm going to go ahead and open it away from me. I'm going to go ahead and get my drape. I'm going to go ahead and open it. And I am able to touch 1 inch margin. So 1 inch, I'm able to touch it. I'm going to go ahead and drop my supplies. Okay. I have 2 solutions, normal saline and hydrogen peroxide that I'm going to be using. I'm going to go ahead and put normal saline in all 3 of them. I got my hydrogen peroxide. I'm only going to put it in 1. So I have a mixed solution, normal saline, and normal saline. Okay. I'm going to go ahead and perform hand hygiene, and I'm going to put clean gloves. I'm going to go ahead and remove the cannula, okay? At this time, you're going to feel some pressure. You might feel like coughing, okay? I'm going to go ahead and take the cannula out, do a little curve motion. I got the cannula, and I'm going to put it on the mixed solution, okay? There's the mixed solution. And I'm going to go ahead and remove the soil dressing. Okay. I'm going to go ahead and remove this. And I'm going to go ahead and discharge my gloves also. Throw them in the garbage. Now I'm going to go ahead and perform hand hygiene. And I'm going to put sterile gloves on, okay? I'm going to go ahead and touch this. I'm going to go ahead and open these. I'm going to go ahead and grab the edges. I'm going to go ahead and put my dominant hand first. I'm going to touch the outside. I'm going to touch the inside, not the outside. Keeping it sterile. Curve my thumb. Okay. I'm going to go ahead and grab the other one. I'm going to curve my thumb. Inside, so they're both on. And now at this time, I'm going to go ahead and clean the cannula. So I'm going to go ahead and grab it. I'm going to grab the brush. I'm going to go ahead and clean it. Clean the inside. Get all the crust out. Clean it. Okay. So, and I'm going to go ahead and rinse it on the normal saline solution. Okay. I'm going to go ahead and place it back on with a little curve motion. Help it go in, and it's in. Now I'm going to go ahead and clean the area. I'm going to grab one of these. I'm going to put some normal solution that I haven't used yet. Okay, wet. I'm going to go ahead and clean around the area, the skin. I want to clean the stoma, remove any crust, any sputum built up. I'm going to clean the flange. Okay, that's clean. I'm gonna put the new dressing. At this time, I'm gonna have somebody come and assist me. Hold the patient's neck, help the trach stay in place. So I'm gonna have an assistant or a nurse come help me maintain it in place. Okay, and I'm gonna put a new dressing. Okay, the new dress is in place. I'm gonna go ahead and remove the ties and put new ties. And I still have my assistant helping me. I'm gonna take out these ties. These are the soil ones. And remove them. Okay, and I'm gonna get the new one. Bring it around the neck. And go ahead and put the new one on. I'm gonna go ahead and tie it. And I want to make a knot. And I want the knot to be away from the skin. And now I'm going to go ahead and grab a gauze and I'm going to put it between the skin and the knot. And I'm going to put a piece of tape. And I want to tape the knot with the gauze. So I tape the knot with the gauze, not the skin. And that's how you perform in changing the dressing on the trach. Anything else I could get for you right now? No? Okay? Okay. So now I'm going to gather my supplies and I'm going to throw them away. I'm going to remove my gloves, perform hand hygiene, and I'm done.